So tonight I worked on this project and decided to do an overview of 4 very important projects that we've been working on this last year. Thanks to you and your support and continued support, we were able to do some very important things for our department. First and foremost, we changed over our incident reporting software this last year. We changed from kind of an antiquated incident reporting software, and we were able to move into a new incident reporting software called Emergency Reporting. This one has a lot of different aspects to it that we've been able to work with over this last year. Obviously, it has incident reporting, which I'll talk about in a little bit. But it also goes into our training records, and all this plays into ISO. It'll play into accreditation and data-driven decision-making for us. So in the training records, it allows us to track the training, set up JPRs, which are job performance requirements, to ensure that all of our expectations are met. Asset management, that is something that we've been working on for the last 3 years. We have a lot of equipment. We have a lot of different types of equipment, facilities, as well as our fleet. And so we've been able to really dive into that, get all of our inventories, put together replacement schedules, and ensure that we have good budgeting practices in the future. Truck checks, our personnel are using tablets for their truck checks. It works right into here. So we're keeping track of all of our inventories and our truck checks on that, as well as putting in work orders just right on the tablets. Hydrants, they're called water hydrants. We have a little discussion going in the background on that. But our fire hydrants are also put into this software, and we're able to keep track of the flows that we do, our inspections, which again is for ISO and for our water department to be able to utilize also, and our personnel. For the occupancy module, we are doing pre-plans, and we're putting in all of our inspections. Our annual inspections all go in there. This is just a one-stop shop for our entire operation, so it's really aided us this year. Our online reporting, or our online library, we've put in all of our SOPs. We've put in training documents, which we can then follow up and hold people accountable for making sure that they're getting their training done and logged, as well as putting in our calendar and events logs, because we're trying to track as many contacts with our citizens as we can. A couple screenshots that I took is the mapping, which we were very excited about. So this is a map of Minot, and it has the little blue dots on there that has how many incidences in that area. And then when we zoom in, we can see the red triangles are fires. The green dots are other. It could be a spill, or it could be lots of different things. And the blue kind of star is a medical call. So that's what we can kind of dive in and be able to see where our responses are and what types. This is another type of mapping. It's called heat mapping. It is not a plume of a hazardous materials spill or anything like that, but the red indicates that we have a lot of calls. So the downtown area has a lot of calls in that condensed area, and you can kind of see where it's flowed throughout the community. So we're very excited about that. It allows me to see when I pull up a map, I can kind of see, and then I dive into the data a little bit more and kind of look into some calls. There was one out in Surrey that I saw one morning. I went, why did we go out to Surrey? But we went out on there on a mutual aid call. So this reporting and analytics, I am extremely excited about. The one on the left dives into an NFPA 1710. This is, if we're compliant, this is only for fires right now. If we're compliant in our turnout times, minimum staffing, which we put in 3, we can change the parameters, and a turnout time of 4 minutes. And this is how we fared for that time frame. So the green is the compliance incidents, and the red is our non-compliance incidences. For our standard, our NFPA standard, they ask for 90% compliance. So as you see in April, we were close. We look at for about 70 is what I would like to see us at, so we're working on it. And all of those marks have to be met. If you don't meet the turnout time of 1:20, it won't go into the green. So every parameter has to be met. So we're looking through that. We're working through the different options. There's ones for EMS, but I just wanted to kind of give you an idea of what we're looking at. The one on the right is a 1500 NFPA standard compliance, which is our health and wellness compliance, which looks at a lot of different areas. It'll look at our facilities, staffing, our medical protocols, our wellness protocols. It looks at training, PPE if it's compliant. A lot of different things that all go into that NFPA standard compliance. So we're working with the analytics. We're getting the data in as fast as we can and trying to see what we can get out of it. We like these dashboards. The facilities plan also plays into the last piece. We've done a lot of different upgrades throughout the last couple of years, and we thank you so much for your assistance in that and your support. Station 3 obviously being the biggest one. Your budget priority is that we maintain our facilities before we add new. So we knew with Station 5 being on the horizon, we really wanted to focus on getting our upgrades done, which was paint, some carpet, and then right now we're working on those replacement schedules, so we know that we're going to need carpet at Station 1 in the next 10 years again. So we're kind of working through those, even those building components. This, unfortunately, is one of our sad projects that we have to talk about. This is reality for us. We have active shooter emergencies that we may have to respond to. My colleagues and I around North Dakota, as well as the nation, when we've talked about active shooter, we've kind of stepped back. That's a law enforcement issue. But in reality, it overwhelms any service. So right now, we've put together a plan for active shooter, and we're working through our protocols. Ward County Emergency Management is bringing in a top-notch trainer actually, in October that will train up some of our personnel, law enforcement, as well as community ambulance, which will then train the rest of the providers. And then we will be working through our protocols with the police department to ensure that we're all on the same page. Fire takes a more active role than community ambulance would. Community ambulance would be staying in the cold zone, per se. Fire goes into the warm zone. So once law enforcement goes in and knows where the shooter is and allows us to come in, then we'll be coming in to take the people out that are injured. We are going to be looking at a grant or some kind of funding to get the ballistic gear for our personnel, to put them in a position where they have the right protective gear when they're going into this, but this is something that we're working through, and it's sad that our society has brought us to that. The next piece is something that's taken us quite a while to work through, but we did an operational planning session. So this is our vision and strategy development that we did. We worked with EAPC and their business development group to be able to facilitate our planning sessions. So this is our execution cycle. We did have our mission already established. We did that right when I got here. We created a new mission statement. We also had our values that we already had created, and that was who we are and what we stood for. We then created a vision with EAPC and with our group, and that's what we're striving to become, and I will share with you our new vision. We created goals, what we're going to look like when we arrive. We developed strategies to meet those goals, and we've broken down our action plans to be able to help us execute them and to be able to bring us into the future. We're also going to create plans for reinforcement and revisions of those plans if we need to. So this was our process. It actually started in January. We did an employee engagement study, and I will share some of that with you. It's actually very interesting. February, we then gathered the team. We had 17 personnel on the team, and that was comprised of all ranks and all personnel, the different positions within the ranks. Together, we created a picture of what our desired state looked like. We identified current gaps of our future state, and then we grouped the gaps into strategies to achieve that vision. We then brought in another group. That was 19 of them, again, all different ranks, and we sought feedback on our vision that we had created and to see if we met the mark at all, as well as for them to look at our strategies. And once they met, we reconvened our group later in March to modify the plan with the feedback that we received and assemble our teams and assign owners for reinforcement. So this is our new vision. So we will demonstrate our pride, dedication, and commitment to each other and the community by, geez, I can't see, it's covered up. Developing and refining our skills to strengthen the department and thus better serve the community. And above all, we will care. That is the biggest thing. So this is some of the employee engagement results, and we're actually very excited about these results because it really gave us insight into our personnel. And this was, again, done in February. So the different colors, it's less than 1 year of service, greater than 10 years of service, 1 to 5, and then 5 to 10. So I want to point out the key driver. That is the highest one. I want to read you a couple of the questions that were asked in that one. Overall, I am satisfied working for this organization. I would recommend this organization as a great place to work. I would like to be working for this organization in 5 years. And I am proud to work for this organization. And that is the highest one. And I think that says a lot for you as a council, as well as our team as an organization for the city. That is huge for our retention. So we were very excited about that. So the development covered opportunity and growth. That's our training program. You supported us hiring a training officer. Thank you very much for that. Motivation to perform. That's empowerment, decision-making, resources available and held accountable. Communication is feedback, open to input, leadership that listens and considers feedback. And I will send this out to you guys. I will give it to Derek so he can send it out and so you can dive into it a little further if you'd like. The two that are highlighted, we're actually going to dive into a little bit. So quality and safety results. The biggest question was staffing levels. You guys know all about that. I mean, it is what it is. And we are back up with staffing. We're down just a couple right now, but we're going to be going through a hiring process here in a couple weeks, and we'll be getting back our staffing level. The second one is belief in leadership. And our focus group actually was questioned on the term leader. What do they mean by leader? And leader was said to be their immediate supervisor. So it could have been their captain, could have been their battalion chief, could have been me or the assistant chief. So the belief in leadership was a little low for 5 to 10 years. But when you look at our organization, we are very young. Even our leaders are. We had all brand new battalion chiefs, 7 new captains. We are very young, just overall. And so these numbers don't scare me at all, but what it does is it reinforces the fact that we need to work through officer development to gain that trust and get those numbers up for us. The greatest survey differences for our staff versus leaders was as shown, but I wanted to highlight the green one. I'd like to be working for this organization in 5 years. For our staff, which is our firefighters, 90%, and leaders, 81%. That is awesome. Trust and respect, I feel like I can trust what my leader tells me. We need to work on trust, as well as a clear understanding of how our organization is performing. I need to do a better job of getting those performance metrics out there so we know how we're performing, and that emergency reporting is really going to help me in that. Gaps in our vision, lowest scores. I just highlighted the top. That one was glaring. It's staffing levels. So it'll be interesting when we repeat this to see if that number should be up. So we've been working very hard on staffing levels. So these are our 4 strategies that we came up with: becoming proactive and progressive, intentionally connect with the community, recruit and retain talent, and strengthen department culture. And these are designed to be completed within 3 to 5 years, and we've created different groups that are going to be working on each of these strategies to develop action plans for them. So that's kind of where we're at. When we have it all put together, we will be getting you a copy of our plan, and so you can dive into it and ask questions as needed. So this is a little bit deeper dive into those 4 strategies. I know we've been here a long time tonight, so I won't get into them, but we do have measures of success. For example, becoming proactive and progressive. Measures of success, we're going to be going through the accreditation book, see how we are and best practices compared to others. ISO evaluation, I'd love to see us moving to a Class 1. Increasing our pre-planning as well as community risk reduction. So the implementation process, we have our team that completed their action plans with due dates. We're setting regular reporting schedule for their strategy progression, identify escalation path if the team gets stuck, and then we also have a communication plan, identify appropriate audience, and setting a cycle to keep momentum for years to come. So our future works of progress, we are preparing for accreditation. Team and I are heading to Williston actually next week, and we are going to be diving into the accreditation book and getting some advice from the group that does the accreditation to see if this is for us and how we can pare it down a little bit so it's not so big. It just seems very big right now. We are continuing to collaborate with community partners, especially Trinity Health, their community ambulance. We've been starting our Cardiac Ready Community. We are involved in Safe Kids Coalition, which is just starting up. We are doing community risk assessments where we're going to assign risk numbers to each facility in town, and then we can dive in and see where our target hazards really are. Our standard of coverage document where it dives into our response, and we'll be able to do more of that once emergency reporting is up and running a little bit more, and succession planning. In a year and a half, unfortunately, we have some more leaders that are going to be retiring, so we're ensuring that we have personnel that are ready for that next step within their career. And that is my report.
Thank you, Chief. Any questions this evening, Alderman Straight?
Thank you, Mayor. Chief, I just want to start off. Sometimes when we have these long meetings, I'm sure
Yes.
staff has a desire to go home early, but
Yeah, they told me 3 slides only. So.
yeah, but I want you to know that the public pays attention to these, the people that watch online, and I never want you to feel like you have to cut, or anyone in any department, because the information is important for the public. So with that, I'm curious, Chief, discussions within internal departments, like the garbage crew goes out. I'm thinking of your attendance at an Eastwood Park meeting that I attended a few years ago. We had an obstacle of getting a fire truck in because of a residential apartment that came to be after the flood, and it shouldn't have been because of zoning. I would love to hear, as the community assessment risks come to be, other discussions within departments of where we might have issues. I think that would be healthy, because I think the public would love to see our police department, our fire department, even our sanitation department participate in some of those community neighborhood meetings. And I'd just be curious to hear what some of that what might come out of it, because I think it's healthy for not just assessing our risks, but also better just being vocal and out in the public. So I just wanted to say, don't cut your presentation short, but it's important stuff.
Thank you.
Further questions for Chief Kelly this evening? Yes, Alderman Wolski.
Brief comment, Mr. Mayor. Chief, I love what the software and the reporting software is allowing us to start to look at. I feel like these are the cornerstones of good decisions and getting a sense of where we're strong and where we're weak. And I think the staff survey that you've conducted is right on target in terms of trying to identify where the department's healthy and where we need to apply a little extra work and grease in some form. So I appreciate the presentation. I appreciate you taking your time to go through it, and I appreciate the work that's being done.
Thank you.
Alderman Patergula.
Very strong compliments. I think the process you're describing in terms of strategic planning is one that the City Council could very well adopt, and we've talked about that a little bit in our retreat meeting, and what you've done in your department provides a very good template for us to probably follow. I have a lot of questions. I'm reminded of one of my favorite movies, The Day the Earth Stood Still, the first one, where the professor, Sam Jaffe, meets the spaceman, and his eyes are wide open, and he says, "I have so many questions." So in the interest of saving time, I will make an appointment to meet with you and your staff and spend a day going over this and getting access to the data and the dashboards. I'm very impressed with what you're describing, and I think this could be a good model for other parts of the city, including the council. So I thank you very strongly and your staff, and I have so many questions, and I'll find another place and time to ask them.
Thank you.
Chief, about the only thing that your presentation didn't have on there was kind of what Alderman Straight was talking about, was the community sentiment. Rarely do I ever hear of complaints, other than maybe a siren or two that's a little loud at the early morning hours, but rarely do I ever hear of complaints about the fire department or even the police department. I think the firefighters, I said the word right, firefighters, are very well respected in our community, and I think that shows up through the ranks from the youngest rookies into where our leadership is at. So please pass that along, and we're very appreciative of all that they do for the community and the parts that they play within the community, because they're also residents of Minot and family members as well. So thank you.
Thank you very much.
With that, we move to